right, so let's review the basics of skin cancer. Now, as a new grad, you're not going to be expected to know the ins and outs of oncology or cancer treatments, but there are a few important points that you'll need to know no matter where you work. So, skin cancer, as with all cancers, involves excessive and abnormal cell growth, in this case, in the epidermal and dermal layers of the skin. They are most commonly caused by exposure to things like UV rays, like the sun or tanning beds. Tanning beds are so bad for you. There are three main types. There is basal cell carcinoma, there is squamous cell carcinoma, and there is melanoma. Okay, those are the three main types. And they are all in order of basically severity. So the basal cell usually affects mostly only the epidermis. The squamous cell tends to go a little deeper, and so you may see some ulcerations with squamous cell. And then melanoma is actually typically mostly flat. It's a dark, abnormal, irregular mole. And so we're going to talk about how to recognize this because it is the most deadly and it is the most likely to metastasize or spread. And when it spreads or it metastasizes, it is very difficult to treat in areas other than the skin. So anytime you have this dark spot or lesion on the skin, we want to assess it to determine if it might be cancerous. So we use the mnemonic ABCDE to decide whether or not this is suspicious enough to get checked out or suspicious enough to get a biopsy. So A stands for asymmetry. Melanoma or other cancerous lesions, they're going to be asymmetrical. So if you split them down the middle, they're going to be different on both halves. B is border. So you'll see the borders are irregular. They're not perfectly round, and they're usually pretty jagged. C stands for color. The color is going to be inconsistent throughout the lesion. So you can see it's really dark here. It's more light here. It's darker again over here. It's an inconsistent color, whereas this is just basically one color throughout the whole mole. Then D stands for diameter. So usually we say anything over 6 millimeters is considered suspicious, which is about the size of a pencil eraser. I remember when I first learned this, I used to take pencil erasers and put them over top of all of my moles just to make sure I was okay. I just wanted to see the size and make sure that they weren't suspicious. So 6 millimeters, anything over that is considered suspicious. And then E stands for either elevation, which means it might be raised, but it's not always, or evolution. Evolution means has it changed in the last 6 months? If you have an irregular looking mole that has changed in the last 6 months, it's gotten bigger, it has gotten more irregular, it's changed colors, that is considered an evolution of that mole, and it does make it suspicious. I actually had one that was right at 6 millimeters. It wasn't huge. It was slightly asymmetrical, but it kept changing. And so I ended up having it cut off and having a biopsy. Turns out it wasn't cancerous, but I had it removed anyways. So it's always important to look for these things and to teach our patients what to look for as well. So once we do have a suspicious mole, we'll get that biopsy, like I said, to confirm the diagnosis. Remember, all cancers have to be confirmed via biopsy or some sort of hematological study under a microscope. We can't do it just by clinical findings. Then if it is a malignant skin cancer, they can do chemo or radiation, or they can even just surgically remove the lesion if it's still localized. More than anything, it's important that we teach our patients how to prevent skin cancer in the first place. So they need to know their risk factors. Obviously, being out in the sun a lot or going to tanning beds is a high risk. So we want them to protect their skin. So we want to use sunscreen with a high SPF. And something that I learned is that even the highest SPF sunscreen has to be reapplied every 2 hours. Even waterproof sunscreen has to be reapplied every 2 hours. So we want to make sure our patients know that. And then obviously avoid the hottest parts of the day, as they call them. Avoid the peak UV times. Usually it's somewhere between 10 a.m. and 2 p.m. depending on what part of the country or what part of the world that you live in. And then, like I said, we want to teach them to monitor their lesions, notify a provider before it gets too severe. Again, if melanoma metastasizes to other organs, it's actually one of the hardest cancers to treat in other organs, and it can be very deadly. Now, this is probably self-explanatory, but our priority concepts for a patient with skin cancer or at risk for skin cancer is going to be tissue skin integrity, cellular regulation for any kind of cancer, and health promotion because we want them to prevent skin cancer. So check out the care plan attached to this lesson to learn more, see more interventions, and read the rationales as to why we do them. Now, this is, again, pretty straightforward, but let's recap quickly. Skin cancer is an abnormal growth of cells in the skin, most commonly caused by UV exposure. We use the ABCDE mnemonic to assess and monitor any suspicious lesions. That stands for asymmetry, border, color, diameter, and elevation or evolution. So make sure we monitor them and notify our provider if it changes. And then, of course, we educate our patients. We want to prevent skin cancer if at all possible, protect from UV exposure, and really understand what it is that's putting your patient at risk. All right, those are the basics of skin cancer. If you do end up going to work on an oncology unit, you'll learn a lot more in detail, but these are the most important things for you to know at this stage in the game. Either way, make sure you're protecting yourself from the sun too. Now go out and be your best selves today, guys. And as always, happy nursing.